Thank you for joining today's program on seasonal affective disorder. So this is the Healthy Libraries program. Stony Brook Medicine's Healthy Library program is a partnership with Public Libraries of Suffolk County, the Suffolk County Cooperative Library System Outreach Services Department, and is supported in part by the American Heart Association of Long Island. This program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, and case management to a diverse community of patrons in the public library setting. Refer patrons to promote access to appropriate health and social services programs locally that will address their social and health support needs, and for students to experience an interprofessional team and demonstrate the core competencies based on the interprofessional education collaborative. These are our student leaders and our faculty and staff leaders that make the Healthy Libraries program possible. And here are today's presenters who I'll introduce themselves.
Very loudly. Hi everyone, my name is Esther and I'm a recent MLS grad from Queens College, and I currently work at NLM as a technological information specialist, and I also hold an MPH from Columbia.
Hi everyone, my name is Christine Weber and I'm in the master's degree program at the School of Social Welfare at Stony Brook. My interests are working with the senior population and those living with cognitive disabilities.
Hi everybody, my name is Winnie and I'm a senior at the School of Social Welfare at Stony Brook University.
All right, hi, I'm Mev Gallagher. I'm a first-year student at Queens College Graduate School of Library and Information Science. It might be studies, actually, but I'm interested in reference and information literacy.
Great, thank you. Okay, now we're going to move on to the learning objectives. So by the end of the presentation, participants should be able to identify the definition of seasonal affective disorder, or SAD, identify the signs and symptoms, identify the time of year that seasonal affective disorder presents, identify treatments of seasonal affective disorder, identify the characteristics of seasonal affective disorder, and identify the criteria needed for a diagnosis. So I just want to ask everyone to please put themselves on mute during the presentation, and you can ask questions during the chat and at the end. Okay, I'm going to pass it over to the first presenter. Thank you.
So hi, what is seasonal affective disorder? Seasonal affective disorder is a mental health condition that is triggered by the changing of seasons. The condition is a subtype of major depressive disorder and bipolar disorder. Major depressive disorder is characterized by prolonged sadness and a general lack of interest, while bipolar disorder is characterized by similar depressive episodes alternating with periods of abnormally high energy and activity, which is hypomania or mania. People with SAD have signs and symptoms of either major depressive disorder or bipolar disorder only during certain months of the year. Major depressive disorder is more common than bipolar disorder among people with SAD. So what causes SAD? While no one really knows for sure what causes seasonal affective disorder, research indicates reduced activity of the neurotransmitter serotonin, which helps regulate mood. Research also suggests that sunlight helps maintain normal serotonin levels. But in people with SAD, this regulation does not function properly, resulting in decreased serotonin levels in the wintertime. Other findings also suggest that people with seasonal affective disorder produce too much melatonin, a hormone that is central for maintaining the normal sleep-wake cycle. Overproduction of melatonin can cause sleepiness. So some of the signs and symptoms of seasonal affective disorder can be feelings of depressed mood of most of the days, nearly every day, losing interest in activities that you once enjoyed, having low energy level, having problems with sleep, experiencing changes in your appetite or weight, feeling sluggish or agitated, having difficulty concentrating, feelings of hopelessness, worthlessness, and guilt, and having frequent thoughts of death or suicide. So seasonal affective disorder tends to start and end at the same time every year. Most people with symptoms start in the fall and go into the winter months. However, there can be people with seasonal affective disorder during the spring and early summer. So some of the symptoms of winter seasonal affective disorder is oversleeping, appetite changes, especially in foods with high in carbohydrates, weight gain, tiredness, and low energy. And some of the symptoms for spring and summer SAD includes trouble sleeping, poor appetite, weight loss, and agitation. Now I'm going to pass it on to me.
Right, so is this a lifelong disorder? Kelly Rohan, MD, writes on the American Psychological Association website that SAD can be effectively treated. However, there is no significant data that points to a cure. The key is to find the correct treatment or therapies that work for you. When it comes to seasonal affective disorder, people have different reactions to the different treatments. One size does not fit all. Once a proper treatment is found, it's important to create a long-term treatment plan to prevent SAD from returning, or at least make it more manageable for the next time it comes back. Essentially, we can't cure it, but we can do a lot to make it more manageable. And here's some risk factors. Family history. A person with a seasonal affective disorder may have a blood relative who also has SAD or another form of depression, major depression or bipolar disorder. The symptoms of these conditions may become worse seasonally as SAD can affect them. And I can tell you, as someone who does suffer from major depression disorder, SAD can be a serious thing. Distance from the equator. Seasonal affective disorder appears to be more common for people who live farther north or south of the equator. This may be due to the decreased amount of sunlight during the day during the winter months. And age and sex. Seasonal affective disorder is diagnosed in women more than men and usually begins between ages 18 and 30. So it doesn't really affect younger people, but like the older you get, the likelier you are to have it. What are the criteria for a seasonal affective disorder diagnosis? To be diagnosed with SAD, a person must meet the following criteria. They must have symptoms of major depression or the seasonal affective disorder symptoms mentioned previously. The depressive episodes must occur during specific seasons, i.e. only during the winter months or the summer months for at least 2 consecutive years. And the episodes must be much more frequent during those seasons than other depressive episodes that the person may experience at other times of the year. So like we said, you know, SAD sort of like increasing like how depressed you might feel, you know, during May versus during January. And diagnostic test for SAD. First and foremost, talk to your healthcare provider or a mental health specialist about your concerns. Do not self-diagnose. And that's it for me.
So a combination of multiple tests can be administered by your doctor to properly diagnose SAD. The first one is a physical exam. The next is blood test, and the doctor can also do a psychological evaluation. So what's the difference between SAD and clinical depression? Similar and overlapping symptoms may make it confusing whether you have SAD or clinical depression. Remember, SAD is a type of depression with a seasonal pattern. If you are wondering if you have SAD or clinical depression, always talk to your doctor. So the treatments for SAD are as follows. First is light therapy. It's a special light box where it can help you to get daily exposure to light within the first hour of waking up. The next is medications, which are antidepressants. Next is psychotherapy, which includes cognitive behavioral therapy. And lastly, mind-body connection, which includes yoga and meditation.
Myths versus facts. So the myths are that SAD is a distinct disease, that SAD is a matter of depression, that it is a separate disease with separate treatment, that light boxes are alternative to medication, and that the more time spent with light boxes, the better. Facts of seasonal depression disorder are that it represents seasonality and affective illness. It is half a mood cycle, half being mania. It is not a distinct disease. They are an adjunct to treatment, meaning light boxes. And light boxes are beneficial during the morning time. So some homeopathic treatments include B vitamins, especially folic acid and vitamin B6. B vitamins are known to play a role in emotional well-being and mental health. St. John's wort can help act as an antidepressant and is wonderful for some people, but do not take St. John's wort if you are antiretrovirals, birth control pills, or other antidepressant medication. Do not take in conjunction with light box therapy, as the herb can cause photosensitivity. Same is a chemical found in the human body that is also produced synthetically and is available as a supplement. It can help people, it can be helpful for certain people in the treatment of depression. But again, talk to your doctor before taking any alternative vitamins or supplements. Some preventative measures are spending time outside every day, even when it's cloudy, because daylight has a helpful effect. Begin using a 10,000 lux light box when fall starts, even before you feel the effects of winter seasonal affective disorder. Eat a well-balanced diet. This will help you have more energy, even if you're craving starchy and sweet foods. Exercise for 30 minutes a day, 5 days a week, and stay involved with your social circle and regular activities best as you can. Social support is very important.
Okay, so here we have some additional resources for anyone that's interested. And now is a good time if anyone has any questions. Feel free to unmute yourself or write in the chat, whatever you're more comfortable with. And if no one has any questions, then this brings us to the end.